lot of people have this idea that antidepressants, they're fixing something, kind of like a type 1 diabetic takes insulin, restoring them to a normal state. That's not true.
Over 35 million people in America take antidepressants, but many are not being told about the long-term side effects of these drugs, says psychiatrist Dr. Joseph Witt-Doring. He's the founder of the Taper Clinic, which treats severe withdrawal symptoms and helps people safely get off of psychiatric medications.
There is a group of people that when you bring them off that medication over 2 months, that's what I would say is a fast taper, they will actually develop very severe withdrawal symptoms that do not get better. They get back on the drug, but the symptoms don't go away.
How do antidepressants actually work? And what kinds of side effects can they have?
What we know is that many of the mass shooters are exposed to antidepressants. In the case of some who are trans, there's also hormone medications as well, which can have a mood destabilizing effect.
This is American Thought Leaders, and I'm Yanya Kellick. Dr. Joseph Witt-Doring, such a pleasure to have you back on American Thought Leaders.
Glad to be back.
So what's the bottom line? We keep hearing about SSRIs, we keep hearing about antidepressants, that they're maybe not effective, not working, but then there's lots of studies that show that they do have a positive effect. What's the bottom line?
So it really comes down to the definition. What does it really mean to say that this medication works? And I think to answer that question, you really have to look at the chemical imbalance theory, because a lot of people have this idea that antidepressants, they're fixing something, kind of like a type 1 diabetic takes insulin. They are fixing this imbalance, they are restoring them to a normal state. That's not true. There's never been any evidence that there's been a chemical imbalance. I mean, we've looked at the CSF, which is the cerebral spinal fluid. We've looked at metabolites for serotonin. We've done post-mortem autopsies on the brains to look at receptors for serotonin. And we've also done brain scans. We've never found a chemical imbalance. And
so we've never found depression connected with a chemical imbalance in the brain. That's the bottom line.
That is the bottom line, yeah. There is no way to differentiate patients who are depressed from those who are not depressed using any objective markers. And that's why when you go and see a psychiatrist or a family medicine doctor, they're not doing blood tests, they're not scanning your brain, they're essentially just doing a checklist. These are not biologically grounded conditions. And so the idea that you're taking a drug that is going to fix that chemical imbalance, that has no legs underneath it, because we haven't even found it, that there's nothing there. Mm-hmm. But what the drugs are doing, and what they are doing fairly consistently for people, is inducing a drug effect. And if we're going to go with the most common class of antidepressants, which is the SSRIs, what that effect typically is one of emotional numbing or emotional constriction, we say. Mm-hmm. And that can be experienced as very therapeutic for some people. If you are in a state where you're having a lot of anxiety and you take a drug and it kind of constricts that in, it sort of numbs that out, you're going to feel better. And if you're highly suicidal, you might even say that that drug saved your life. Mm-hmm. And so I think that, yes, these drugs do work. They consistently produce this effect, and that can be experienced as therapeutic for some people. But for others, and this is why oftentimes you'll never hear psychiatrists or the media kind of talk about them as having a drug effect. But for some issues, numbing someone out and masking those problems is actually going to make them worse, because they need to actually focus on why they're unhappy instead of just like masking them with the drug.
So the bottom line is basically it's complicated.
Yeah. It's a lot easier of a narrative to kind of sell, like, you have a chemical imbalance, you have a problem, take this drug, it's going to kind of pick it up to a place that's normal, nothing to see here. But the truth is that depression is so much more complicated than that. You can have problems with your relationships, with work, your physical health can sometimes result in depression. And if you're not addressing those things and you're just kind of masking the symptoms with a drug, sure, you're going to feel better. You could say that it's working, you could say that it's helping, but it's not actually getting to the underlying reasons. And this is really important because over time, these drugs actually wear off. People become tolerant to them. And then so you can get into a situation where you're sort of maxed out on the dose of the drug. It's wearing off. You're not experiencing that therapeutic effect anymore. And you still have all of those problems that led you to getting on the drug in the first place. And this is what drives polypharmacy. The tolerance, they need to start another drug. It wears off and they start another one. And this is why you hear that some people are on 4, 5, 6 medications. Now they're going for things like ECT and TMS. It's not really a sustainable long-term strategy for many people. And one of the really sad things about what I'm seeing in my field right now is that there's some dishonesty when it comes to explaining to patients why all of these medications aren't working. Because I think an honest response would be, yes, this is the understandable and predictable outcome of masking symptoms with a drug effect that your body is adapting to, and here we are. But many patients are told that, well, you have treatment-resistant depression, your mental illness is evolving, you've developed a new condition, and so they don't really tell the patients honestly what's happened, and then they just keep on stacking on treatments, when the solution might actually be to come off of them and find another approach.
So your work is focused a lot on helping people come off of these psychiatric drug cocktails, and I think as we're starting to talk about that, I want to mention that it's incredibly important for people to do it properly with help. It needs to be done slowly, it needs to be done with support, because sometimes cutting them off very quickly, which some people might be tempted to do if they realize that those drugs might be actually now the problem, it can cause its own suite of problems.
Yes. Yeah.
If you could just speak to that a little bit.
Yeah, so it's an area where there is some nuances needed. Now, so I work it's a specialty practice. People come and find me after they've had difficulty coming off their medications. Now, I want you to imagine that, let's say you've been on an antidepressant or something like Xanax or Klonopin for several years. That's a lot of Americans. Quite a large group of them can actually stop these drugs pretty quickly. Within a couple of months, they have really nasty withdrawal, but then they kind of pull through it and things normalize for them. They move on with their life, and withdrawal's never really a big issue for them. I would say that they have very healthy, elastic brains. There's something just about them that allowed them to adapt to coming off that drug really quickly, readapt. Now, what I focus on in my work is a smaller piece of that pie. There is a group of people that when you bring them off that medication over 2 months, that's what I would say is a fast taper. And that's really common for a lot of family doctors and psychiatrists. They will actually develop very severe withdrawal symptoms that do not get better. Well, they'll develop very serious withdrawal symptoms that don't get better in that time frame. Now, there's 2 really important things that most people need to be aware of here. The first thing is that if that happens to you and you don't have one of these very elastic brains that can readapt quickly and you get through it, your doctor will tell you sometimes that, well, this is unexpected. I've been taught that you can taper people in 2 months, that the withdrawal is mild, that it's going to go away, and because that hasn't happened with you, this is proof that your underlying condition is coming back. And this means that you need the drug. And so they'll put the patient back on the drug, and this person essentially ends up on an unwanted medication, potentially indefinitely, afraid that they're unable to come off. And so that's happening with a lot of people. Now, the other area, which is even less common, but it's very important, is that some patients, when you pull them off the medications too quickly, particularly antidepressants and benzos, they develop a condition called protracted withdrawal. And probably the best way to describe this is just to tell you what it's like for a patient. So you go in and see a doctor and you're coming off Xanax or Klonopin. These are really common sedatives. Your doctor pulls you off pretty quickly, or maybe you do it yourself, and you end up with a lot of withdrawal. You're anxious, you can't sleep, your ears are ringing, all pretty normal stuff. 1 month goes by, 2 months go by, and you're still feeling unwell, and you're white knuckling it. You say, if I just hang on long enough, I'm going to get through this and I don't want to give up. 3 months goes by, it's still there. And then you say, you know what, this is too much. I want to get back on the drug. I can't deal with this. I'm going to figure out another way off. They get back on the drug, but the symptoms don't go away. And so then you have a person who, is essentially has severe anxiety, brain fog, ear ringing, kind of a whole host of neurological problems. That person's actually experienced a form of brain damage. And that's really what I focus on in my practice, is this small group of people who come off, whose nervous systems become incredibly sensitized. And for them, it usually takes them about 18 months to 2 years to recover. Sometimes it's even years after. It's like you've had a concussion, and that has been really important for me because it's actually changed the way I practice. I now recommend to anyone that I talk to, that you have to come off these medications in a controlled way. You need to do it gradually because severe withdrawal for some people, and we cannot predict who they are, can actually cause this type of injury which is very disruptive to their lives.
That's a really compelling point. We're going to continue after a break, and folks, we're going to be right back. And we're back with psychiatrist and founder of the Taper Clinic, Dr. Joseph Witt-Doring. The other dimension that we haven't talked about yet is the side effects, which I understand often people coming into using these drugs are not aware of. And I'm not talking about the sedatives, but I'm talking about the SSRI antidepressants.
So the side effect issue, if I were to list the ones that I'm most concerned about, and there's a lot, so I'm going to move fairly quickly on this. The first one is something that everyone should be aware of, and that is the risk of actually not dealing with the real problem. Because if you go and see a doctor and they're just like, hey, Jan, you have major depressive disorder, take this medication. But actually, maybe there was some issue with your relationships or your work or something like that. You're distracted. You now think, I'm going to understand these problems as coming from my brain, and you miss the opportunity of actually addressing real issues in your life, and so they fester. That's the main thing that I really worry about. Now, there's some other issues which are less common but important, and so one of them is behavioral changes. And so the ways these are have turned up in the media is really the issue of drug-induced suicide and drug-induced homicide. And so that is, I'm not going to say that that's a common issue, but it's something that people need to be aware of. And they kind of have similar mechanisms, which I want to go into. So, as I mentioned before, these drugs, the SSRIs, generally have like a blunting and constricting effect. But all drugs, recreational and otherwise, there can be a group of people who will have a paradoxical, it'll have a paradoxical effect on. The example I like to use is you could have 10 people sitting around smoking some cannabis, 9 people are giggling and having a good time, and you get one person who becomes paranoid. There's just something unique about that person's, their brain and their genetics, that they have that bad reaction. Now, if we're talking about suicide, if you get someone who is already depressed and then you expose them to a medication and they have one of these paradoxical reactions, you can actually make them worse. You can kind of tip them into actually acting on those behaviors. So not only are they depressed and suicidal in the first place, now they become more depressed, more agitated, more impulsive, very blunted and disconnected. They're not having a therapeutic experience on it, and so they may impulsively end up taking their life because of the medication.
And then what about homicide?
Now, this is a very controversial area that does not get a lot of coverage. And this has turned up in a lot of discussions about school shootings. Actually, that they notice that school shooters are taking SSRIs, and so I want to unpack that. But I want to start by saying this: I'm not trying to say that every single school shooter or mass shooting event is due to SSRIs. I think clearly it's a multifactorial problem. I think we have issues with social contagion that spurs this on. I also think we have to be real. We have a lot of firearms in this country, and because of that, if someone's having a adverse behavioral reaction to a medication, you can grab a gun. You know, if there's not guns around, you grab a knife, but obviously a gun is a more deadly weapon and it can cause more harm. That said, the role that these antidepressants play has to be considered. And I want to talk a little bit about the drug labels quickly before I go into this, because I know some people, they hear this and they go, this is quackery, you know, there can't be a link here. If you just look at the drug labels for Adderall and Ritalin, in the warnings and precautions, it already lists aggression and hostility. This is where they put the most important risks. If you look at SSRIs, it already lists there in the label that they increase the risk of suicidal behavior. It lists hostility, agitation, and violence. If you look at Abilify, which is an antipsychotic, homicidal ideation is already in there. And so what I want people to be aware of who are listening to this is these risks are actually already in the drug labels from the manufacturers. Now the question is, okay, sure, maybe there's some violence, maybe you can have homicidal ideation, but can this actually, you know, has this been linked to actual homicides? And time again, we've seen this go through the court system, and judges and juries have found that this has been involved. And perhaps the most well-known case of this was a case in Wyoming, and it involved a gentleman called Don Shell. He was an older man, and he had been exposed to Prozac in the past, an SSRI, and he had an agitated response to it, and they stopped it quickly. His next doctor, who did not know that he had that history in the past, gave him a drug called Paxil, which is an SSRI. Now, this shouldn't have happened given he already had a bad experience to the same drug class. And so Don's new doctor put him on Paxil, and within a week, he killed his wife, he killed his daughter, and he killed his granddaughter, and then he shot himself. I mean, an unspeakable tragedy for the family. Now, the surviving son-in-law, his daughter's husband and the father of the grandchild that he lost, brought suit against SmithKline. This is before GSK had formed, and this was heard out before a jury in Wyoming, and they ruled in favor of Tobin. That was the name of the son-in-law who survived. He was given $1 million verdict. It was for failure to warn. SmithKline appealed it. It did not change the verdict. And so we already have court cases where judges, juries have heard the information and said, you know, if not for the drug, this wouldn't have happened. The same thing happened in Australia. A man strangled and killed his wife during a bad reaction to Paxil again. And the judge ruled there as well, if not for the drug, this wouldn't have happened. And there's been many other cases that have been described in a paper by David Healy, who really is the big expert on this, called Antidepressants and Violence, Intersection with the Law. And so this is already happening. I know we don't like to talk about it in the media. It's something that's very suppressed, but the courts are already dealing with this, and they are finding that these drugs are playing a role. What we know is that many of the mass shooters are exposed to antidepressants. In the case of some who are trans, there's also hormone medications as well, which can have a mood destabilizing effect. And so there is potential there that you get someone who is already unhappy and you put them on a medication that's known in rare instances to cause these issues, that can lead to or precipitate violence. Now, the problem is that we're really not looking at it, and it's very rare to evaluate someone who does something like this, because they usually take their life. The only case that I've really heard of recently where we were able to interview someone where it looked like there was a relationship was the Aurora shooting. I think it may have been 12 people were killed in Colorado. It was the Batman shooting where James Holmes dressed up as the Joker, I believe, and he murdered a lot of people there. Now, so there were multiple forensic experts that ended up interviewing him, And one of them, David Healy, he believed that if not for the Zoloft, this would not have happened. And the way that he kind of pieced that together was that he noticed that when James went up on the dose, which is commonly the time that people become destabilized, he had a clear behavioral change. He started to send flirtatious messages to his roommates, which was a very big change from a very reserved, quiet, sort of nerdy guy. He ends up dyeing his hair red as well, and his behavior markedly changes. And then 3 weeks later, he ends up doing this terrible mass shooting. And so what happened there? Well, it looks like it induced a manic episode. Now, the defense actually chose not to run with that story. Not really sure why, but I think it has to do, again, with the death penalty was on the table. If there was a whiff that we're trying to look for something exculpatory, that might not go down that well. And so they actually didn't use it, but the whole case was described really well in the BBC documentary, A Prescription for Murder, and they actually go through all of the details. If someone's really interested in that, it's a great watch. You can just Google it. But to me, I thought that was a very compelling temporal relationship between increasing the dose, having a clear behavioral change, and then shortly thereafter committing a mass shooting. The reason why it's actually so important to look at this is because people are afraid to. If we started looking into these mass shooting events and actually kind of, even if the family doesn't want to talk about it, investigating it, talking to the surviving family members, okay, were they on a medication? Had they had any dose changes? Did you notice any changes in their behavior recently? You know, if yes, were there any alternative explanations? Were they using drugs or anything otherwise? Because if we're finding that these rare events that happen on these medications are actually a part of this, as a country, we might decide that when we put someone on an SSRI, we say, hey, I really want a spouse, a family member, or a friend here, so I can say, in very rare instances, these may lead to behavioral changes that can sometimes result in violence. Over the next month, I just want you to check in on this person. If you think that there's any changes, call me immediately and let's talk about it. Because these drugs are often given out almost in like these 5-minute appointments with family medicine doctors, and you don't know if that person's really being monitored. And so it can lead to better informed consent. It can lead to having important conversations with family members about supervision, and that's really what I hope is going to happen, because in Tennessee, the governor, Bill Lee, actually, with bipartisan support, was able to get a bill through recently to look into the role of psychotropics in mass shootings. And so they're actually finally going to investigate this instead of just trying to move on from these tragedies.
Well, Dr. Joseph Witt-Doring, it's such a pleasure to have had you on.
Thank you for having me again.
Thank you all for joining Dr. Joseph Witt-Doring and me on this episode of American Thought Leaders. I'm your host, Yanya Kellick.